Welcome to Clicks and Coffee. Today I'm honored to introduce Kate Granigan, a distinguished leader in the field of aging life care management. Kate serves as the CEO of LifeCare Advocates, a premier care management practice based in Newton, Massachusetts, dedicated to assisting older adults and their family navigate the complexities of aging. With a master's degree in social work from Boston College and over 27 years of experience as a licensed independent clinical social worker, Kate has devoted her career to enhancing the quality of life for seniors. She is the 2024 president of the Aging Life Care Association and serves on the board of and serves on the advisory board, of the Massachusetts Guardianship Association. I'm excited to delve into Kate's journey, her insight on aging life care, and her vision for the future of senior care. Kate, welcome.
Thank you very much. It's very nice to be here.
So I've read a little bit about you before this podcast, and I know that the story of LifeCare Advocates is a very interesting one on how you started it. So if you don't mind
Sure.
letting people know how you started and what was your career before and how this got started.
Sure. So as you mentioned, I'm a clinical social worker by training, and I began my career, in a different area of the families. I was working with younger families and their parents when I first started my career. I did that for a few years and then began to work at the other end of the spectrum for a visiting nurse association that, did home visits to older adults as they recovered from, illnesses or issues that were, needing them to have a home visit from nurses and then social workers as well. So I did that for years and I really enjoyed it, but I became frustrated with the limitations of the role, because very often, if you know anything about this, you know that the insurance for covering something like that is limited to when the person is actually ill and needing that assistance. But once they begin to recover, then all of the support goes away, including the clinical social worker. And I found myself getting ready to discharge clients or patients and having them or their families say, how do we keep you? We'd like you to stay involved, because although her wound has healed, mom is benefiting from your engagement and your information, and so are we as a family. So I, ran into that question and had to say, no, I'm sorry, that's not available. Here's a few resources. And then, unfortunately, I'd probably see them again, because oftentimes aging adults without the right resources and support sort of cycle through incidents or issues in their healthcare. So I fast forward, decided one day, not with any business background, that I was going to take the leap of faith and open a different kind of service that allowed me to work with clients when they wanted it or needed it, or in a proactive way. And I opened a business, and that's how I got started.
The rest is history.
The rest is history. It was not this business. I opened a solo practice many years ago, and then early end of the 1990s, and then grew that business sort of organically, which spoke to the need that was there even then and is still growing. And then I then ended up selling that practice to a nonprofit and worked with them in the aging life care division until I was asked to, by the founder of this company, LifeCare Advocates, to be her successor CEO. And I joined this particular group, although I knew them well through our professional work, but I joined the team here in I'm on my 8th year, and still love it every day. It's a rewarding.
One of the things that's fascinating with all of the guests on the podcast is that there is a common thread, I would say, which is passion and true care, which is great. And it feels good because, as you age or as you have aging parents, you're always stressed, because you have your own life. And so knowing that we have people in this country that truly care about what they do, it really makes you feel better, on both sides, I would say. And so I know that LifeCare Advocates, is really like a holistic client-centered approach. Can you explain a little bit how this methodology benefits older adults and their families?
Absolutely. So the work that we do, because we are working for the client, we are actually, hired by the client to work with them as a consultant and an advocate. And because of that, we are not limited by, insurances or regulations. We're working through, obviously the best practices, but we're very flexible and creative in working with older adults. And it really allows us to get to know them. And when we say holistically and person-centered, it really is about looking at the whole person, not just the silo of their medical care or their finance or legal or housing. We're looking at all of those aspects of their aging journey, asking questions and having knowledge and information in every area that might impact their decisions or their care or their wishes. And then getting to know that and their support systems, we can then put together, a unique plan to help them meet their goals and also have, realistic and appropriate information in order to, understand the pros and cons and make sometimes pretty critical decisions about their next steps or helping families navigate what's best for their aging parents.
And so in your experience, what have you seen in general, like the challenges or like the most common challenges that older adults face, and what are the strategies, I would say in general, or like, what you see the most common, the strategies that have been more effective in addressing those issues?
Sure. I mean, the reality is, I think in today's, society, we have, we're embarking on a system or a situation where we have more older adults in general because they're living longer, because we have, lots of ways that we can help with medical and other conditions. So people are living longer. They also typically are having less children and some having no children at all. And, so, some of the best ways that we can help is helping people, really evaluate early on as possible in a proactive way, what their goals are, what are the resources that they need to rely on or be aware of, and then helping them be an educated consumer, because there's a lot of information out there, some of which isn't particularly accurate or helpful, and it's hard to discern, how to compare apples to apples, or when you're looking at senior housing, for instance. You need to understand, one, what is my goal? My goal is to remain in my own home, which so many people obviously want. It's really important to remember, to know what that's going to look like. What does that look like now? And what is that going to look like if you have mobility issues? What's that going to look like financially when you need more help? And what's the cost of that? And what's covered and what isn't? What's your plan B if that doesn't work? And we do that with people around all of those things, right? Same with healthcare. Sometimes, people are dealing with new diagnoses or, complicated decisions that they're, needing to sort out. And they may have family that can help with that, or they may not have family, or they may not want to burden their family. A lot of times when people are working with us or seeking help, our role is to be an objective professional expert that can look outside of the family ties and emotions and really help with some fact finding, and then delivering that information so people can make the best choices. So ideally early on is great. But my, 27 years in the industry lets me know that just because we know we should do something doesn't mean we do. That's the same with legal planning, financial planning. So planning for the aging journey isn't always, something people want to talk about,
And in recently was seeing more and more articles about how things are changing in the industry.
Sure.
One being, Gen X getting into into the age technology. We see also memory care that is increasing a lot. How is LifeCare Advocates preparing, I would say, for that shift and also with technology.
Yeah.
That's a big one.
Right, right.
But how are you guys preparing, for that shift, or
Mhm.
maybe you're already doing something? I don't know.
Well, I mean, because we do this for a living, we've seen the writing on the wall for a while, right?
Okay.
We've been aware of the changing dynamics, including increased population with the baby boomers turning 10,000, turning 65 every day. We've got a lot of people coming into the field or into the scope of what we need to know and understand. I think some of what we know as an industry and as an association of aging life care professionals nationally, which you just mentioned. I'm just in the role of past president. We're really trying to look at being on the cutting edge. So it is about understanding technology, understanding what the options are, where it's going to be useful, and where we need to push back a little bit. Because while technology is going to be critical as numbers increase and the workforce, both paid professionals that do caregiving and things like that, and then also the non-paid caregiver, family members, we are going to need to enhance how we support that population, because there's not going to be enough people. So using virtual tech, using AI in some cases to help with information sharing, really we are looking at growing the awareness of the work that we do as aging life care professionals, so that people can, be most efficient in making plans and decisions, and always being responsible as we do our jobs to know, what's new in the field of the medical care around cognitive impairment, memory loss, Alzheimer's, dementias, and the like. We need to be experts and staying up on that. So that's some of the ways that we're preparing, but, we're always hiring new staff. We are the Aging Life Care Association itself, and our practice here in Massachusetts, our team are master's level social workers, nurses, other folks in the healthcare industry, physical therapists, occupational therapists. And then we have an elevated certification that gives us that holistic understanding, so that we can really help evaluate people's needs and give qualified and informative advice, and then also make connections. So if there's a lot of things that we might understand the logistics of the financial, costs of things, but we're not financial planners. We're going to need to know someone's circumstance so we can make a good referral. We're same with legal, same with housing or healthcare. All those aspects, we want to make sure we're making the best, match for that person's circumstance. If they have financial, means, is a different recommendation than, somebody who's on a limited income. We want to make sure we're being responsible to all of that and helping them with the best possible plan. So.
Yeah, no, I know. And I know that cost is a lot of the time a big issue, and we're seeing, for senior facilities where the monthly cost can be like in the tens of thousands of dollars per month,
right,
which is pretty crazy. And so, hopefully technology would help, I would say, cap that increase, because I'm not going to say it's going to go down,
right,
but at least, to be able to kind of cap that increase over the years,
right,
through multitude of factors.
right. Well, being able to scale support in a way with technology so that we can, and that's really a goal for all of us, to work at the top of our license and doing the things that are clinically and personally necessary to serve our clients, but also looking at other alternatives that may be more cost effective, time, consideration of time and resources, so that we can be the best we can be for our clients, but also preserving their assets for things that are most important. So that's an important factor.
And so going back to technology, what is the one thing that I would say you're the most excited about in technology for the industry, but also for yourself?
Yeah, sure.
For your company.
Mm-hmm. Yeah. Well, it's interesting. We're always looking at technology. I have, regular communication from people that reach out to tell me they've developed the best app that's going to make aging, so much easier, and decision making, non-existent. It's going to do all the thinking and all the care, and and I am skeptical because I do believe in the human touch and the importance of communication and nuances that we would never, and I'm also not very tech savvy, but I recognize that with that there are going to be ways to partner to work on efficiencies. So in our company, we're constantly looking at ways to use technology for our efficiencies, to reduce the burden and the load on the care manager, the aging life care professional that's trying to serve the client. So how can we take some of that load off so they can see more people doing work that's meaningful? That's one way technology, I think, for our company is being evaluated, but it's also going to be critical across the country and for those of us in this field. We do work with, I think some of the other technology that's interesting and has been around but continues to improve is monitoring technology. I think for a lot of people, we work with a wearable item for our clients, and we use that at the time when they're, they may not feel like they need much help in the house, or they may feel like they don't want people in overnight, for instance, or we might be wanting to monitor how they're getting around and doing after coming home from a fall or a stroke or something. And so we can use this technology to see their activity without being an interference. It's being monitored in the home. We can tell when they're going from room to room. We can see if they have a fall that's unresolved. It gives us a lot of data points, which help us to then, listen to them when we say, how did you sleep? Or how's that new medication working? We know that people's reports isn't always what's happening. It's what they feel like it's happening. It's obviously subjective. And so we can take their subjective report on how they're sleeping and look at the data points and say, you know what, you've stopped getting up at night now that we're on this new medication. And so that seems like it's working.
Yeah.
So those are nuances that I think will really enhance.
I agree with you 100% on that. And to me, that's where I'm excited to see with technology and monitoring. And the reason is that I think, especially in this industry, we should work on a technology that will free up time for people for human interaction. So it's really using technology for stuff that is not human interaction, so that way we have more time with that, because at the end of the day, that's what people care the most about. And I see it with my grandfather, actually, and personally involved in that. And unfortunately, I live here in the US, and he's in France, but we have a WhatsApp group, and I see all of the care that he needs, because he doesn't want to move to a retirement home, wants to stay home. And so everybody is kind of relaying and helping with technology. And the funny thing is, we do use monitoring. We have little cameras a little bit throughout the apartment, so we can kind of see where he is.
Right.
That's good.
And I think that's going to be, as we move into the next era of, many, many, many older adults needing and wanting, they want, obviously, what we all want. They want to be independent. They want to make their own choices. They want to be where they want to be, where they want to live, surrounded by who they want. And so I think the more that we have these supported services and ways to do that, the more choice people will have and opportunities, and some of which may reduce costs, by for a period of time, by delaying, having to leave the house that's already paid for, and, being able to use some of these things for safety and monitoring without, disruption, I think is going to be a game changer. And we need to watch for that and monitor what's available. So I think that's important.
Yeah, no, for sure. And so what are the plans, I would say, for your company in the future? Because it seems to me that, having a company where you care about not only placing people, giving them care, but really how to manage that. What's the future for LifeCare Advocates? And I want to hear, the plans and stories about the company.
Sure. Well, I think for me, it's just the future is the future is bright, because there's a lot of need. I think we have an exceptional product. I'm very proud. We have a wonderful, committed team of compassionate and, skilled people. And I think our goal is to continue to add to that, to add to that bench of folks with expertise in a variety of areas that will meet the needs of our clients. I think for us, we're also looking at what kinds of, what's out there, what are the gaps that people do need, and where can we fill that? And then looking at innovative ways to be in the space, in the aging space, in a meaningful way. So I think that's on the horizon. We also have, about a year ago now, and we're just really getting some traction, began a program that it's called the Flourish program. And this is a program where, while our aging life care managers are often dealing with our clients around concrete needs for safety and well-being and healthcare, and it's not that they're not also wondering what will bring them joy and meaning and purpose, but oftentimes the other things take precedence. So we started this program, Flourish, with a designated staff person who is working with the clients who engage to understand their unique desires, goals, interests, and then putting together a plan to help them access that. And she's using everything from, depending on the client. Some of our clients they're at home or in a facility with, a significant cognitive impairment. And so what she does with that person is going to be different than the person who, unfortunately has some poor mobility and needs help or is restricted in what they can do, but they're incredibly sharp and cognitively intact. And that person might be, she had a client who's an avid reader of philosophy. And so she and he put together a plan. He wanted to discuss certain philosophers. She went away and gathered information so they could have a meaningful engagement. We have another client who is super interested in a certain genre of music and remembering going to concerts and was a pretty unhappy person in a skilled nursing home. And after working with her in the Flourish environment, with that as the purpose, that is what she's there to do, bring joy and help people flourish. And this person was unrecognizable to the staff. He was happy, he was humming, he was waiting for her to come each week, and that changed his experience outside of even that work, because he became more pleasant. And so people were engaging him more, and he made a few friends. And so things like that, I think the work we do is incredibly important, but the Flourish program is, for me, sort of it's sort of a passion project, because I think if we're aging and just kind of going along the journey, doing the things we have to do, and we forget that there are things that we want to do or would gain pleasure or joy from or meaning, we're sort of just existing. So being able to bring that joy has been, and we will continue to explore ways to do that in a more expansive way. But that's sort of a really fun activity that we're embarking in.
I agree that the mental state, can have a very, very big impact on the physical state.
That's right.
And we actually know that there are some health issues related to that. And that not only for the older population, for everybody. But
all of us.
No, that's a really good. That's a really good idea, and that's something you should talk about. I would say even more, because, as you said, a lot of the time it's very reactive.
Yes.
The care and being able to have something like that where we keep and we help also people, because as they get older, it's just gets harder and harder to get the info. Things are changing. Where do I get this? Imagine we're looking at, some people maybe used to go to Blockbusters and rent movies, and then all of a sudden it's like, how do I watch movies?
Right. Absolutely. Yeah, that's been fun. The other piece that we do with that, we did a pilot with a company that does virtual reality for people with dementia that has a headset, and it was specifically geared towards working with people with cognitive impairment and dementia. And then they did a handful of studies in assisted and independent living and memory care communities, and then reached out to us to try this within our home settings that we work with clients. And so now that virtual reality experience is part of an offering we do through the Flourish approach. It's, we have clients who, can go and visit just through Google Maps in the virtual reality that, is run by an iPad sort of, they can see their home from 50 years ago. We can take them on a virtual tour of their town, when they grew up there. They can go back to Ireland and see, where their grandparents were, or do a tour of the Louvre. So it's pretty amazing. And
that reminds me, have you ever watched a series called Black Mirror?
No.
So Black Mirror is a very dystopian, not very fun series. However, in general, because it's like it's a collection of episodes of how technology would affect our future.
Sure.
But it's really taking like one piece of technology and kind of extrapolate how it could impact. Most of them are not very happy ending. I'll just say that, I just want to be honest with you.
Fair.
However, there is one episode that is exactly that, and it's actually in a retirement home that people get put into this virtual reality, but it looks like you're reliving yourself when you were young. And it's a very good ending. Like, it's the whole episode, it was like, you have a tear at the end of the day, because such a beautiful, like such a cute and beautiful story. There is one.
I'll look for that one.
Yeah. But be careful. The rest you have to be,
a little dark. Okay.
Yeah, it's a little dark. So you have to be warned before you start watching, because some people, they watch one episode, they're like, nope, I'm good. I do not want to see more of that.
Oh, well, and I think we have a fear of technology naturally, and especially older adults. It's not what they're familiar with. So I think part of it is taking that fear down and being able to engage in ways that's different, and helping people do maybe with adaptive opportunities what they otherwise wouldn't do or couldn't do. So I think it's just, I think there's a lot of room for technology. I think we need to be cautious and not lose the fact that
open but cautious.
Yes,
I totally agree. But me, I'm totally on your side, where for me, especially in that industry, technology should not replace people, but it should be an enabler for having more time to have this human interaction. There is actually one of our clients, it's called Mobius MD. And what they do, so it's more for doctors, but what they do, it's like a AI powered dictation system. So you're with a patient, and instead of let me write that down, you put your phone on the side, have a conversation. The whole conversation is recorded, interpreted, and transcribed, and gets uploaded into the EMR, which is the electronic medical records. And that way you can truly take the time and talk to the patient or the person, and have a better care, and have people feel really valued as human, and not just I would say a billable patient.
Yeah. Well, and I think that's often one of the complaints we get, of course, from our older clients who have had their doctor they saw for decades retired, or had been their age to start with and is now retired, and they're getting shuffled around to a primary care doctor that is working from a very different set of playbooks. They have 15 minutes to not only talk to the client or the patient, and hear their concerns and respond to that and get their notes in before they have to be into the next room. And our older clients, one of the things we do is help. We take a lot of our clients to those medical appointments because we help them prepare ahead of time. What do we need to know? What's on our list? What do we need to put at the top to make sure it's addressed in case we run out of time? What are the outcomes we need? A new prescription. We need an answer to why I need that test. And so when we're working with people or coaching people as they do that, that's why, because we know that's limited. We know that even, any one of us can go into a medical appointment and be overwhelmed because it's quick, and you're talking about things that feel really important, but you're trying to articulate that, you're trying to get a response and outcomes, and that can be a lot. So we do help families and coach people as they do those things, because they feel that pressure. So what a neat product that your client is providing, because it does just what we said, technology that's enhancing the ability to do what's really important. I like that a lot.
Yeah, no, exactly. Well, Kate, it was a great pleasure having you. I really enjoy meeting people like you that, prepare people. So, no matter your age, give a
Right.
call to Kate.
Yeah.
Any question that you have about aging, I think that Kate and her company will totally help.
Yeah.
So they have a beautiful website, which is lcadvocates.com. We'll put it also in the description, as well as email, phone number. So whatever you guys want, you can reach out to them.
Yes.
I wish you all the best, for the future, and
Thank you.
I would say good luck with all the increased amount of people that are gonna need help.
Yeah.
So it's a big challenge ahead, and I'm very excited for you.
Thank you. We're excited too, and we really appreciate the opportunity to share what we do.